So this is on the subject of chelation, and this is really part two, in which I describe how to know when to stop chelation. So with gadolinium, it tends to be fairly straightforward because we know how much gadolinium we got and how many injections. So we have a good sense of how much gadolinium we have to deal with. And as a whole, I've used the formula that for every gadolinium injection you've had, you need 5 chelations to remove the gadolinium. And the reason why it's 5 is, again, to go over that chelations remove most of the gadolinium from soft tissues, which is easier to access and remove than bone, which is the largest reservoir. So when we chelate, we remove gadolinium from soft tissues. At about 3 weeks' time in earnest, re-equilibration occurs, which is gad moving from bone back to soft tissues. And a flare is associated with that, flare of symptoms, and we expect it because if you're sick from the metal, then when you have re-equilibration, then it will make you sick again. Now, people are not sick from it. So for instance, myself with gadolinium storage condition, I do not get flares because I'm not sick from gadolinium. So that again tells you that you're not sick from either gadolinium or lead or something else. If you're not getting removal flare, you're not getting re-equilibration flare. Removal flare early on, re-equilibration flare, most people at 3 weeks. If you have a ton of it in you, re-equilibration may start at 10 days in earnest. Realistically, re-equilibration is occurring shortly after the gadolinium has been removed, but it doesn't really start get in earnest so that it's clinically appreciable till 3 weeks in the majority of people. So how to know then when to stop, beyond that, because some people, the fortunate few, need fewer chelations than one for every one gadolinium injection, 5 chelations. So if you've had 3 gadolinium injections, you times that by 5, then that's 15. Some require fewer. So how do you know you're ready to stop? A number require more if they have more complicating factors. And major bone injuries like spine injury, major surgery, tends to be amongst the most common complicating factors that require you to need more chelations. And I think it reflects the fact that more gadolinium is simply stored because of these events than happens in people who don't have these injuries. So how do we know to stop? Well, I tell people to target when you feel about 80% better. Now, again, with gadolinium, I use when the urine result is in the low yellow range, and 3 micrograms per 24 hours to 5 micrograms per 24 hours to start thinking that maybe it's time to stop. Now, if the agent you had was a very durable, very tightly bound agent like Prohan, Stoterem, Clariscan, you may never even be that high as 3 micrograms per 24 hours in the post-chelation. So then you have to use symptoms. So I tell people, and it's the most reliable really for everyone, when you feel you're about 80-85% back to yourself, you should look at stopping. Now, how you do that is simply, if you're getting chelation for example, most of my patients every 3 or every 4 weeks, if you miss one chelation and the re-equilibration, which again everybody gets, is manageable, and by 3 months is, if anything, it's much less. It's lessened by 3 months. Then it's time that you look at stopping. If, however, you stop chelation and then that chelation session that you were supposed to get, during that time, re-equilibration is bad. And if at 3 months it keeps escalating, that's telling you that you stopped too early. And I tell people, listen, doesn't mean there's any damage, doesn't mean anything horrible has happened. It just means that you're not ready to stop chelating. So we just go back to chelation, things will be fine. And if anything, now since we've moved more gadolinium from bone back to soft tissues, since we've waited, we can get more gadolinium out. So in some ways, it's a good thing. So you use pausing to see if you've had enough. Now, the other thing I want to mention that is, it seems not understood even by experienced practitioners, is it's not at all uncommon that people will have chelation. So we'll say you had 1 gadolinium injection, you had 5 chelations. After the 5th, you're about 85% back to yourself, feeling really quite good. And over the course of time, at 9 months or a year, the symptoms have crept back. And you could sort of panic, as some people do, and say, oh my God, now I'm back to where I was. Everything is ruined. Everything is lost. No, it's a common thing, because remember, re-equilibration is occurring constantly. So although I use 3 months as the decision point, re-equilibration is constantly occurring. Now, the good news also, as it's re-equilibrating, it also, some of that gadolinium and moving from bone to soft tissues, which includes moving from bone back to brain, it also, some of that gadolinium is also being eliminated in urine, which is a great thing. But the point is, I tell people, listen, it's not at all common that maybe at a year's time, some of those symptoms are starting to come back. Like, for instance, I've had one person that couldn't really move their arms and their shoulders well, and they were a carpenter. So at 1 year's time, they were getting problems with their shoulders again. I said, well, that's not a problem. It just means that we've re-equilibrated a lot of the GAD, and it is now bringing back symptoms. So we now just have to chelate you again. And quite often, 3 more chelations, again, spaced, whatever it is, 3 to 4 weeks, whatever you're using, and they're fine. So it's a natural thing. And I've heard some people say, well, I'm getting symptoms back at a year's time, so it's got to be something else. No, it is not something else. It is a normal thing that happens with GDD, that in some people, they require still more gadolinium removal. In some way, it kind of reminds me of electroconvulsive therapy for depression, that it also follows a pattern of multiple sessions for initial treatment, and then later, maybe annual, occasional, maybe sometimes for a long period of time, annual ECT sessions. It's a different thing, but it's a kind of a similar principle, that sometimes at a year's time, you need to have more chelations. Now, a couple of people have done it for 2 years in a row, and that's been fine. And that's why also I'm thinking in the future for certainly gadolinium patients, but maybe for everyone, they should be on some sort of oral metal chelator that works. And again, you say, well, how do I know if it works? It works because 24-hour urine before, 24 hours immediately after, and that metal's gone up a lot in the urine, tells you that chelator is working, the most reliable test. So is Richard Samelka. This is when to know when to stop chelation, and you don't make a mistake if you start too early. Just go back and get more chelation. Thank you.